Currently, 89% of Americans over the age of 60 are disregarding these warning signs. And this could end up costing them their lives. It is likely that you are ignoring the signs of aging or stress as the cause of the symptoms you are experiencing. But your heart is making a desperate attempt to communicate something to you. For each day you choose to disregard these warning signs, your chances of experiencing sudden cardiac death grow by 12%. I will reveal 13 warning signs that could save your life tonight. But you must remain with me for the next 15 minutes. Before we get started, if you are concerned about your health, I would like to invite you to click the subscribe button and enable notifications. This is because it is here that we reveal the truths that no one else discusses. I would also like to know if you are with me. If you are watching now. If this video resonates with you, please type 1 in the comments section. If not, please type 0. You are unaware of how important your voice is. As a healthcare professional, I was taken aback by the following. Currently, there are more than 6 million people in the United States who suffer from heart failure. And the majority of them are unaware that their bodies have been trying to send them warning signals for months. The dramatic chest-clutching moments seen in films are not the kind of warning signs we are discussing here. Instead, 94% of the population simply overlook these subtle, everyday signs, the true ways that your body cries out for assistance. The information that I am going to share with you is based on decades of medical research and data from thousands of patient instances. The fact that certain warning signs are so particular that having knowledge of them might actually mean the difference between living and dying is what makes them so important. Other people are so prevalent that you have most likely encountered them this week and dismissed them as insignificant matters. I want to take a moment to tell you about Margaret, a 72-year-old who lives in Phoenix. It was 3 months ago when she began to require an additional pillow in order to sleep properly. She was of the opinion that it was simply a matter of personal preference for comfort. After that, she started waking up with a gasp, struggling to get air, but she attributed this to the anxiety she felt over her grandkids. She assumed that she was simply in poor physical condition when she began to feel short of breath while lacing her shoes. Margaret was suffering 3 classic early warning signals of heart failure. But like the majority of Americans, she disregarded them until it was nearly too late to do anything about them. The horrifying reality is that your heart will not wait for a convenient time to fail. Months before any crisis arises, it begins to send out distress signals. According to the American Heart Association, those who recognize these early warning signals and seek medical treatment can prevent 90% of heart failure-related emergencies. Conversely, for those who do not pay attention, there is a 50% probability they will not survive their first significant cardiac event. It is important that I make it clear that this material is for educational reasons only and that it should never be used as a substitute for seeking advice from your healthcare physician. With that in mind, let's get started by delving further into these potentially life-saving warning signs. All of the information that I am sharing with you is supported by reputable medical research. And I will provide references to the relevant studies so that you can discuss them with your physician. If you or someone you know experiences any of these symptoms, particularly if they are experiencing more than one of them at the same time, please get medical assistance right once. We will now begin our investigation of the 13 warning signs that your heart employs in its appeal for assistance. Starting with the symptom that is most frequently misinterpreted and that affects millions of Americans on a daily basis. 1. Shortness of breath during exertion. The first indicator that should raise concern is experiencing shortness of breath while engaging in tasks that were previously completed without any difficulty. This is not a discussion of the feeling of being out of breath after running a marathon or climbing several flights of stairs. We are referring to the sense of being out of breath when you walk to your mailbox, when you climb just one flight of stairs, or when you carry groceries from your car to your house. Your heart is attempting to convey an important message to you if All of a sudden, you find yourself struggling to breathe after performing tasks that have never been a problem for you in the past. This is what is now taking place within your body. Your heart muscle is unable to pump blood at a sufficient rate to satisfy the oxygen requirements of your muscles when you are engaging in physical exercise if it is weakened. You get a sensation of breathlessness because your lungs are overworking themselves in an attempt to compensate for the lack of oxygen. This form of exertional shortness of breath is one of the earliest and most dependable markers of developing heart failure. According to research from major cardiology facilities, this symptom is very worrisome because of the way it progresses. The majority of people adjust to changes in a gradual manner without even noticing it. You might begin to use the elevator instead of the stairs. Park your car nearer to the entrances of stores. Or ask other people to assist you with carrying heavy products. You justify these changes by attributing them to the process of becoming older or to being in poor physical condition. But the reality is that your heart is truly calling out for assistance. Medical research shows this particular symptom typically manifests anywhere from 6 to 12 months prior to the emergence of any other noticeable indicators of heart failure. The primary distinction between heart failure symptoms and regular fatigue is the amount of time it takes to recover. Healthy people recover quickly from physical activity. But if you require long periods of rest following routine activities, seek medical attention immediately. 2. Orthopnea, shortness of breath when lying down. It is possible that you will be surprised by the second warning sign because it occurs when you are attempting to get some rest. Orthopnea is the term used to describe the condition in which a person needs an increasing number of pillows in order to be able to breathe adequately when they are sleeping. This progressive transformation is considered to be unusual by a large number of people. This is because it develops over the course of months or even years, making it difficult to detect. The force of gravity no longer assists your heart in pumping blood back from your legs and lower body while you are lying down flat on your back. When your heart is weaker, blood starts to accumulate in the veins that are responsible for returning blood from your lungs to your heart. When you are in a prone position, the backup forces fluid to leak into the lung tissue, which makes it harder to breathe. According to research conducted at major medical institutes, roughly 80% of individuals who are diagnosed with heart failure at the time of their diagnosis exhibit symptoms of orthopnea. The progression is gradually and subtly deceptive. You might begin with 1 additional pillow, then gradually increase that number to 2, then 3. In the end, a lot of individuals discover that the only posture in which they can breathe comfortably throughout the night is while they are resting in recliners. The fact that people justify this change by rationalizing it makes this symptom more deceiving. They attribute it to allergies or sinus difficulties, or just believe that it is a matter of personal taste for comfort. Your cardiovascular system is attempting to communicate something really significant to you regarding the pumping ability of your heart if you have transitioned from sleeping in a flat position to requiring many pillows or sleeping upright in order to breathe appropriately. 3. Paroxysmal nocturnal dyspnea, sudden nighttime breathlessness. Of all the possible warning signs, the third one is the one that is most likely to instill fear in a person. It is most often experienced during the middle of the night. The sensation of drowning while lying in your bed is how it feels. And it is referred to as paroxysmal nocturnal dyspnea. You are jolted awake, typically after 2 to 4 hours of sleep, and you gasp for air in a panicky manner as your heart pounds in your chest and you begin to worry. This phenomenon occurs when, after you have been lying down for a number of hours, the fluid that has built up in your legs during the day begins to redistribute itself throughout your body, including to your lungs. This abrupt increase in fluid volume, which is overwhelming for your heart, which is already damaged, is causing you to experience extreme shortness of breath. This symptom is so severe that it jolts you out of sleep in a state of dread. The occurrences compel people to immediately go to windows or doors in order to open them, frantically searching for fresh air. Certain individuals have described their sensation as being similar to drowning or choking. According to clinical research, this symptom is among the most terrifying sensations for people with heart failure. And it frequently results in visits to the emergency room in the middle of the night. The fact that this symptom is so often misattributed is what makes it so particularly harmful. It is common for people to attribute these occurrences to dreams, panic attacks, or sleep apnea. Although these illnesses are known to cause sleep disturbances, the precise pattern of waking up gasping for air, particularly if it is occurring more frequently, constitutes a medical emergency that necessitates an immediate assessment. 4. Profound fatigue. Of all the warning signs, number 4 is the one that is most frequently disregarded, despite the fact that it has the potential to be the most incapacitating. It's an exhaustion so profound that even the most mundane of everyday activities feels like an arduous trip up Mount Everest. This is not the kind of typical fatigue that can be alleviated with rest. This is a fatigue that persists even when you get enough sleep. And it makes it difficult to carry out things that you once enjoyed doing. Your body will make a decision to survive in the event that your heart is unable to pump blood adequately. It redirects the flow of blood away from muscles and organs that are less essential. And it instead directs it toward more necessary sections of the body, like as your brain and heart. This results in a reduction in the amount of blood that is delivered to your skeletal muscles, which also reduces the amount of oxygen that is delivered to them. This can lead to severe exhaustion and weakness that can impact every facet of your everyday life. This symptom can manifest itself months before other, more visible indicators of heart failure become noticeable. According to research that has been published in major journals that focus on cardiology, the impact that it has on both exercise tolerance and recovery time is especially troubling. These days, you need to take extended periods of relaxation after going on a brief stroll. But in the past, it would have invigorated you. Even the simplest actions, such as taking a shower, making food, or climbing stairs, turn into grueling ordeals that leave you feeling depleted for hours afterward. Many people are unaware of the significance of the changes they make to their lifestyles since the process is frequently so gradual. They begin to abstain from activities, turn down invitations to social events, or invent reasons to avoid physical work. They attribute the issue to age, stress, or a lack of physical fitness. But this progressive reduction in stamina is indicative of your heart's battle to provide your body with the most fundamental requirements for oxygen and nutrients. 5. Peripheral edema, swelling of the feet, ankles, and legs. Among the early warning signs that can be observed, warning sign number 5 is one of the most conspicuous. Despite this, a large majority of individuals disregard it until it reaches a critical level. The medical term for it is peripheral edema, and it refers to swelling in your ankles, feet, or legs. This is not the type of puffiness that occurs as a result of consuming salty foods or sitting for an extended period of time. This is swelling that persists and worsens over time, particularly at the end of each day. Because of gravity, blood starts to accumulate in your lower extremities when your heart is unable to pump effectively, which is a result of the fact that blood is not circulating around your body as it should. Furthermore, since your kidneys are receiving less blood flow, they respond to this by storing both sodium and water. As a consequence of this combination, fluid is forced out of your blood vessels and into the tissues that surround them. This results in apparent swelling that can become fairly pronounced. At the time of diagnosis, peripheral edema is evident in around 70% of heart failure patients. According to research, in the most severe instances, swelling can begin in the feet and ankles and then proceed upward to include the calves and even the thighs. You may realize that your socks are leaving deep indentations on your skin, that your shoes are becoming tighter and tighter as the day goes on, or that rings that used to fit you well are suddenly feeling too tight. The pattern is of diagnostic significance. Swelling that is associated with heart failure typically occurs symmetrically, which means that it impacts both legs to the same degree. Additionally, due to the effects of gravity, this swelling tends to become progressively more severe as the day goes on. This is an indication that there is a considerable amount of fluid buildup that requires immediate medical attention if you apply hard pressure to the swollen region and it results in an indentation that remains for a number of seconds. 6. Rapid weight gain due to fluid retention. It is possible that warning sign number 6 is the most objective and quantitative early indicator of the development of heart failure. The weight gain is happening swiftly because of fluid retention, and it is occurring at such a rapid rate that it should be a cause for immediate concern. We are not referring to the slow increase in weight that results from overeating or the pleasures that are typical of the Christmas season. This is a rapid and dramatic increase in weight that can occur over the course of only a few days. This particular warning sign is described in great detail in the medical guidelines provided by the American Heart Association. If you gain 2 to 3 pounds in a single day or 5 pounds or more in a week, it is important to contact your healthcare physician as soon as possible. This is not merely a suggestion. It is a medical emergency that demands quick attention in order to prevent the development of additional, more serious issues. This rapid weight gain is caused by the fact that your failing heart generates complicated hormonal responses that lead your kidneys to aggressively retain salt and water. Roughly 1 liter of surplus fluid accumulates in various parts of your body for every kilogram of weight that you gain. Clinical research has highlighted the fact that weight gain frequently occurs prior to the emergence of other symptoms that are noticeable or troubling. Although you may not have yet noticed any considerable swelling or severe shortness of breath, the scale does not lie when it comes to fluid accumulation. Cardiologists frequently encourage patients who are suffering from heart failure to weigh themselves on a daily basis, first thing in the morning, and to report any abrupt increases in weight as soon as they see them. This is for this very reason. It functions as an early warning system that has the ability to prevent emergency hospitalizations, as well as complications that could be fatal. 7. Nocturia, frequent nighttime urination. The 7th warning sign is frequently confusing to individuals since it is connected to a restroom behavior that appears to have no bearing on the health of the heart at all. The term nocturia is used to describe the condition of having to urinate more often at night than during the day. Although there are a lot of people who believe that this is caused by aging, an enlarged prostate, or drinking fluids before going to bed, it is possible that it is actually a subtle early indicator of heart failure. While you are in an upright position and active during the day, gravity causes fluids to build in your lower extremities, due to the fact that your heart is not functioning at its full capacity. It is unable to pump this collected fluid back to your kidneys for proper processing. On the other hand, when you lie down at night, the force of gravity assists in the redistribution of this collected fluid back into your general circulation, which causes your kidneys to become unexpectedly flooded with fluid that they were unable to process during the day. Your kidneys respond to this flood that occurs throughout the night by working hard to get rid of the excess fluid. As a consequence, the amount of urine produced during the nighttime hours is significantly higher. Nocturia, which is defined as the need to urinate during the night, is one of the earliest signals of heart failure that may be detected. According to research that has been published in cardiology journals, in some cases, nocturia can arise months before more evident symptoms, such as shortness of breath or visual swelling, become apparent. Patients frequently say that they wake up 3 to 5 times per night in order to urinate, and that each of these episodes is accompanied by the production of an unusually high volume of urine. This pattern is very important since it is indicative of your heart's failure to effectively manage the distribution and processing of fluids over a 24-hour cycle, which is what would be considered a normal function. 8. Chronic nighttime cough. Disturbances in sleep are a symptom that is listed as the eighth warning sign, and it is frequently attributed to a variety of causes. With the exception of heart problems, the cough is one that is chronic, and it tends to occur most frequently while the person is lying down or at night. This is neither the dry cough that is linked with allergies, nor is it the productive cough that is associated with respiratory infections. People frequently refer to it as a persistent dry cough that keeps them from sleeping. It also seems to alleviate while they are sitting upright. Orthopnea and this cough that occurs at night are both caused by the same physiological process. When you are lying down, fluid that has built up in your body over the course of the day as a result of your daily activities redistributes itself. This can lead to a minor accumulation of fluid in your lung tissue. Coughing is the normal response of your respiratory system when it detects what it believes to be a blockage or irritation in your airways. And it is an attempt to remove the irritant or obstruction. This cough is described in medical literature as being normally more severe during the wee hours of the morning. And it is occasionally accompanied by a faint wheezing or whistling sound. On a regular basis, patients report that the cough produces little to no sputum or that it occasionally comes up frothy mucus that is pink or white in color. These are both unequivocal indicators that fluid is in fact present in the lung tissue. The fact that it is so simple to incorrectly assign this symptom is what makes it so especially misleading. Individuals attribute it to allergies, post-nasal drip, dry air, or the conditions in which they sleep. They attempt to resolve their sleep disturbances by switching pillows, using humidifiers, or using cough suppressants, but they never consider the possibility that their heart could be the root cause of the problem. 9. Palpitations, irregular heart rhythm. Dealing with the rhythm of your heart is the subject of warning sign number 9, which can be an important resource for providing early warnings about the possibility of heart failure in the future. When you are in the early stages of heart failure, your heart begins to work harder and harder in order to adequately pump blood throughout your entire body. As a result, you may experience palpitations, which are sensations that feel like your heart is fluttering, beating, or skipping beats. As your heart muscle becomes weaker, it frequently experiences difficulty in maintaining sufficient blood flow, which causes it to develop irregular beats. It is possible that you will get the feeling that your heart is beating very rapidly, even when you are perfectly relaxed, or that you will have the disconcerting impression that your heart is missing beats, or that it is doing somersaults inside of your chest. There are individuals who describe the sensation of feeling as though their hearts are attempting to escape their bodies. According to research conducted at major cardiology institutions, there exists a bidirectional association between heart failure and cardiac arrhythmias, especially atrial fibrillation. Cardiac failure can result from irregular cardiac rhythms, and heart failure can cause arrhythmias that are potentially life-threatening. This results in a cycle that is potentially harmful, and that can quickly deteriorate if it is not detected and treated in a timely manner. Palpitations are typically most evident while a person is resting or lying down, and they may be accompanied by feelings of worry, restlessness, or a general sensation of unease. Palpitations can be brought on by a variety of factors, but if they occur in conjunction with other potential symptoms of heart failure, they should be evaluated in detail by a cardiologist in order to eliminate the possibility of serious underlying issues. 10. Dizziness and lightheadedness. The 10th warning sign might be very disturbing, because it has an effect on your sense of balance and your brain. Many people ascribe the symptoms of dizziness, lightheadedness, or near fainting episodes to a variety of factors when, in fact, they can be early warning signs of heart failure. The reason you experience these symptoms is that your heart has become weak and is unable to pump enough amount of blood to sustain the blood flow to your brain that is necessary. This is particularly true when you are engaging in physical activity or when you are changing positions. Your cardiovascular system typically responds to instances in which you stand up suddenly or engage in physical activity by raising your heart rate and altering the tone of your blood vessels. These actions are carried out in order to keep your blood pressure at a steady level. Nonetheless, if your heart is not functioning properly, it will not be able to make these crucial modifications effectively. This can result in temporary but large decreases in the amount of blood flowing to your brain, which can cause you to experience dizzy or lightheadedness. Clinical investigations have shown that roughly 20% of heart failure patients experience fainting episodes. These episodes can sometimes occur months before other, more evident symptoms manifest, making them an early warning sign of heart failure. Quick movements, standing for long periods of time, or light physical activity that would not have previously had any effect on you are common triggers for these episodes. Misattribution is what makes this symptom especially worrisome in comparison to others. Dehydration, adverse reactions to medications, difficulties with the inner ear and low blood sugar are all common causes of dizziness that people frequently point to as the culprit. Dizziness, when experienced in conjunction with other possible signs of heart failure, indicates a significant reduction in your heart's capacity to pump blood efficiently. Even though these illnesses can undoubtedly produce comparable symptoms. 11. Digestive issues and loss of appetite. Although warning sign number the 11th of May appeared to be entirely unrelated to cardiovascular health, stomach issues can be significant early markers of the development of heart failure. If, following the consumption of just a small amount of food, you find yourself experiencing a persistent feeling of discomfort or fullness, a decrease in your appetite, or abdominal bloating, these symptoms could be indicative of a problem in your circulatory system that is having an impact on your digestive organs. In addition to impacting the muscle of your heart, heart failure has an effect on your entire circulatory system, including the flow of blood to your gastrointestinal tract. This is the reason why these symptoms arise. When your heart is unable to pump blood adequately, the amount of blood that flows to your digestive organs is drastically reduced. In addition, fluid may build up in the cavity of your abdomen, and your liver may get congested with blood that is not being circulated through your system as efficiently as it should be. As a result, a series of digestive issues ensue, which can have a significant influence on your quality of life and nutritional status. It has been demonstrated through research that these gastrointestinal symptoms are often disregarded by both patients and healthcare practitioners due to the fact that they appear to have no connection to cardiac problems. This results in delays in diagnosis and treatment. Following the consumption of only a few bites of food, patients who are experiencing these symptoms have reported feeling uncomfortably full, having a continuous feeling of nausea without any obvious explanation, or experiencing a prolonged feeling of bloating that does not go away with the use of conventional therapies for digestive issues. Heart failure can cause the liver to become congested, which can result in pain or pressure in the upper right quadrant of your abdomen. 12. Bendopnea, shortness of breath when bending over. Of all of the early warning signals of heart failure, the 12th one is the most revealing. However, it is so particular that the majority of people are unaware of its existence. Bendopnea is the name given to the phenomenon of experiencing shortness of breath within 30 seconds of bending forward. This occurs while you are in the process of tying your shoes, when you are picking something up off the floor, when you are bending over a sink, or when you are bending down for any other purpose. The first documentation of bendopnea in medical literature occurred in the year 2014. Studies that have been conducted since then have demonstrated that it is an extremely specific sign of increased pressures within the heart. The pressure inside your abdominal cavity is elevated when you lean forward. This rise in pressure causes your diaphragm to be pushed upon, which in turn causes a temporary increase in pressure in your chest cavity. If you are already experiencing difficulties with your heart due to high filling pressures, This additional mechanical stress might soon cause you to develop shortness of breath, which can feel rather worrisome. According to research published in major cardiology publications, almost 30% of patients with heart failure experience bendopnea, which is significantly associated with more advanced illness and an increased risk of catastrophic consequences. Researchers consider the symptom to be a non-invasive method of evaluating pressures on the heart. This is because the symptom is so dependable in terms of diagnosis that it eliminates the need for intrusive testing techniques. The specificity of bendopnea is what makes it especially important for early detection of the condition. This symptom is rarely seen by those who are in good health, which means that it is a warning sign that requires prompt medical intervention. 13. Cold extremities and pulse changes. Alterations to your circulation, which you may be able to detect in your hands and feet, are the subject of the 13th warning sign. The possibility that your heart is not pumping with adequate force to maintain proper circulation throughout your body is indicated by the continual feeling of coldness in your hands and feet, even when the weather is warm, as well as by variations in your pulse pressure. Your cardiovascular system will immediately reduce circulation to your extremities in the event that you develop heart failure, since it will prioritize blood flow to the organs that are essential to your survival.